that really excites me about medicine is the idea of working with people, people from across society, and working in the bigger NHS team.
I think it was just natural to want to care for people. I didn't have much exposure to hospitals or anything like that, but it was just always a dream. Growing up, I refined it and I wanted to be in a position of being able to serve others and be useful in my community, but also I wanted to do it in a way that I really enjoyed.
And because I would like to reduce health inequalities, and I believe that everybody should have equal access to healthcare services.
Because doctors are in a unique and respected position to help make a huge difference in people's lives.
I love the idea of being able to be a lifelong learner and someone who has a positive impact in society. And these are kind of attributes that I've really accelerated throughout my time in medical school and in my intercalation in public health.
I'm looking for a fulfilling career, something that's emotionally fulfilling, satisfying to do day in, day out, but also something that's academically challenging.
I wanted to give back to a profession that saved my life twice during my childhood.
I also really enjoy the challenge of problem solving to try to make a diagnosis, particularly when it might be quite a complex presentation.
And I've always been good at sciences, and I also wanted a career that would allow me to engage and communicate with people.
Medicine provides a wide scope for carving different career paths, and that's something that really excites me and drives me forward.
I've been surprised by the lack of diversity in some areas of medicine, especially in certain specialties.
The big surprise for me has been the emphasis on healthcare innovation, enterprise and entrepreneurship.
Moving around as a student between different placements, I have realised and been surprised by how fragmented the system can seem at times, and also the complexity of NHS organisations.
I've been most surprised by the variety in medicine and the range of careers that are available. I think before I came to medical school I thought that everybody would just become a GP or become a consultant in a hospital, but now I realise that within those career paths there are so many different things to be able to get involved in.
I've actually been very surprised at how far behind the NHS seems in terms of its use of technology. I think the world is advancing much quicker than the NHS is, for example. I think it's quite interesting that as these technologies have been rolled out, they've sometimes been given a frosty reception from some more senior clinical staff, which I didn't expect.
There's a number of doctors who advise against medicine as a career choice, be it the long hours, increasing litigation or stress, and ultimately the main complaint is the impact it has on family life.
So what surprised me so far in medicine is the advancement in medicine over the past couple of years, the use of technology and to deliver excellent patient care.
And finally, I think the NHS is a lot more disjointed and inefficient than I would have hoped. For example, a lot of secondary care doesn't have access to primary care records, and a lot of clinicians spend a large amount of their time and resources on NHS admin.
In an ideal world, my career would involve being a GP and working in a community and being able to provide continuity of care to patients.
Something academically challenging with scope for practicing cutting-edge medicine, doing new research and engaging in teaching and medical education, but also something that incorporates variety with those things, so learning new skills, working clinically and academically.
A good career would be working in women's health, and that would be working not just in terms of clinical care, but also advocating for women and also working with policymakers.
I know that I want to work in a front door specialty. I want to see acutely unwell patients. So a career in emergency medicine, it's attracting me at the moment. And I love clinical practice, but I've realised quite recently that actually what I want from a career in the NHS is the flexibility to, alongside my clinical work, do research and do teaching, do other bits of clinical work outside of the standard clinical environment. And I think the reason I want to do that is to have a good balance of other things in my career, and that will keep the clinical work exciting.
My ideal career combines clinical practice with enterprise, entrepreneurship and research. I have strong interests in sport and exercise medicine, nutrition and lifestyle medicine, and prevention. I believe that in each of these aspects, there are plenty of opportunities for growth and impact.
I like to see myself as a bit of a craftsman. I'd like to do a hands-on specialty, so something like surgery would be ideal for me. But I think kind of further along the line, I'd love to branch off into something like management or health policy, in keeping with my interests in my public health integration, because I'd love to have a long-standing and wider impact on society's health.
So my dream career, I'm qualified. I specialised in obstetrics and gynecology. I work in global health medicine, specifically tackling ways of dismantling norms which put women at danger, which increase the health inequalities for women. I see myself as a health advocate. I'm getting really excited talking about this.
Giving us the freedom to think and think of new ways to do things. So that would be a way to support myself and other people to succeed.
I think the really important things for me is to know that I have supervisors who take my interests, my career aspirations into consideration, who are there to support me. It's a fairly daunting prospect going out to work as a foundation doctor, but actually knowing that that support is there and how to find it is really reassuring.
I'd also like my employer as a system to keep up with technology. So obviously technology is moving fast, and at the moment I feel like my generation can keep up, but the organisations are struggling to match that speed of change. I can't imagine practicing cutting edge medicine if I'm still contacting colleagues through pagers and fax machines.
So anything that maximises my learning, anything which exposes me to obstetrics and gynecology, to maternal health, to maternal mortality, to anything that's going to help me, that's going to support me.
I think it would be great if there were more opportunities after the foundation years to spend some time just working in different specialties to gain clinical experience, and also some work experience if people aren't really sure about what career they want to go into, and particularly for general practice. I think it would be really good to have more opportunities to work in different areas of medicine and able to develop skills in those areas that can then be translated into the community.
Internships and placements would allow me to network with leading researchers and practitioners.
Interestingly, so far, I feel like a lot of the opportunities I've had, I've kind of created off my own back. So in terms of being supported, I feel like perhaps the medical school could do more to provide structured support to students in thinking about and helping them develop their career pathways, for example, by having career fairs and providing mentors.
I worry about working in a system that relies on my resilience to get me through it if that support's not there. And certainly, having heard stories from other people who started working in NHS, I do feel nervous about finding myself in a situation where I had to whistle blow, or for whatever reason I was working in a difficult and poorly supported environment.
So there seems to be a continuity gap when you take that leap from the university bubble towards being part of a hospital trust as an employee, with different people, different rules and different processes. And that's something that, despite working on placement, I still don't know a lot about.
Some of the challenges have been, because it's not a career which is like obstetrics consultant, it's quite difficult to figure out how the hell to get there. So that's one of the challenges, is that there isn't like a particular idol that I can look at and say, yes, I want your job.
Oftentimes it can be difficult to feel like an integral part of the clinical team, and I think this can lead to missed learning opportunities on placement, especially in the younger years. I also do think that there's quite a negative culture amongst medical students about NHS as a career, with the kind of lengthy training programs, unsociable hours, etc., etc. And I think a lot of students kind of see this as starting on the back foot compared to some of their peers who maybe did different STEM subjects.
One of the main issues I've seen is the lack of encouragement for medical students to be innovative and seize upon opportunities to improve practice and patient care. Also, there's a difficulty in translating research into practice?
There's an obvious onus on the individual to address these challenges, but actually as an employer, facilitating career opportunities should they wish to attract the best employees, and then encouraging a culture that aims to retain and develop young doctors instead of putting them off or burning them out would be a good place to start.
What I would hope when I start working is that I'm working in a system that makes junior staff like me feel empowered, feel valued, and feel empowered to make change in the system to support them and their colleagues and patients.
I think more communication between employers and future or current employees to address their concerns and come up with solutions is reasonable. And there might be a role for the medical school as well in facilitating discussion, representing the voice of future doctors that they're training as well.
So in terms of feeling like part of the integral team, I think there really needs to be a culture shift within medical schools and within placements to push the ideas of student doctors rather than medical students. And I'm really pleased that this is something that Leeds are actually doing, but I think more could be done to kind of accelerate this. I think students need to be seen as apprentices of their medical trade, rather than just people to just sit in a room and observe.
I think it's important that the system recognises that a career in the NHS is more than just participating in service delivery, and that the system supports opportunities for personal development, to be involved, for example, in education or research, because ultimately I think that will support us to have more varied, happier careers where we are able to deliver better care to patients.
Seeking out people who can serve as mentors, and really just sort of staying committed to the dream. That's something that can definitely help.